Hello and welcome to today's session. Today we're looking at pharyngitis. Pharyngitis is the inflammation of the pharynx. The pharynx is the back part of the throat. The most common type of pharyngitis is viral pharyngitis. We also have bacterial pharyngitis, and the most common cause of bacterial pharyngitis is the Streptococcus bacteria. Looking at the types of the regions of the pharynx, we have the nasopharynx, oropharynx, and laryngopharynx. Okay. Pharyngitis is the inflammation of the mucous membrane of the oropharynx. So the oropharynx is the one that is mostly affected out of the three regions. So the pharynx serves as a passageway for air and food, and also facilitates respiration, digestion, and immune defense, while also preventing aspiration of foreign substances into the airway. Let's look at the major functions of those three parts. Starting with the nasopharynx. The nasopharynx is the uppermost part behind the nasal cavity. It is the passageway for air from nasal passages to the lower pharynx. It also contains adenoids, important for the immune defense. Oropharynx is number 2 and is found below the nasopharynx. It extends from the soft palate to the base of the tongue. It is the passageway for both air and food. It receives chewed food from the mouth and directs it into the esophagus. It also participates in respiratory and digestive processes. The laryngopharynx is the lowest part of the pharynx and is found below the oropharynx. It is the passageway for air into the trachea, leading to the lungs, and it prevents food and liquids from entering the airway. It contains epiglottis to prevent aspiration during swallowing. We have several types of pharyngitis, starting with the most common one, which is viral pharyngitis. It's caused by viruses such as rhinoviruses, influenza, common cold, and monoclonus. Bacterial pharyngitis is caused by Group A Streptococcus, the strep bacteria. Other bacteria could include Mycoplasma. Allergic pharyngitis is caused by allergens, which could include pollen, dust, molds, or foods. Irritant-induced pharyngitis caused by smoking cigarette or environmental pollutants, including dry air and chemical irritants. Gastroesophageal reflux disease-related pharyngitis is caused by the gastroesophageal reflux disease, whereas clergyman sore throat, this is caused by the irritation of the laryngopharyngeal reflux. That's why it is also referred to as laryngopharyngeal reflux disease. So how does a viral infection or viral pharyngitis occur? Majority of pharyngitis cases are caused by viruses. We also have bacterial infections also causing pharyngitis. Also allergens that includes pollen, dust, certain foods also lead to allergic pharyngitis. We also have environmental irritants that occur when we are exposed to smoke, pollution, or dry air, which normally irritate the throat and cause pharyngitis. And lastly, gastroesophageal reflux disease, which causes acid reflux, can lead to chronic pharyngitis when the stomach acid irritates the throat. So viral pharyngitis, it typically occurs by and caused by various viruses, including the rhinoviruses, adenoviruses, influenza virus, the monoclonus. These viruses normally invade the pharyngeal tissues, leading to localized inflammation. And the inflammatory response in viral pharyngitis normally leads to symptoms such as sore throat, coughing, running or stuffed nose, and fever. Bacterial pharyngitis is generally caused by the strep, is also referred to as the strep throat. So bacterial pharyngitis is primarily caused by Group A Streptococcus. So these bacteria invade the pharyngeal tissue, triggering an immune response and inflammation. The pathophysiological mechanism in bacterial pharyngitis normally leads to infections such as sore throat, severe sore throat, so that this inflammation is caused by bacterial infection resulting into intense throat pain. We also have fever, swollen and red tonsils, and painful swallowing. Allergic pharyngitis occurs when the pharyngeal tissues become irritated and inflamed in response to exposure to allergens such as pollen, dust, or certain foods. So the pathophysiological processes in allergic pharyngitis result in symptoms like throat irritation, sneezing and runny nose, and watery or itchy eyes. So this is the major distinction between viral pharyngitis and allergic pharyngitis. So allergic pharyngitis normally leads to additional allergic symptoms which include eye itching and tearing. Gastroesophageal reflux disease is associated with the backflow of the acid, stomach acid, and the contents into the throat and the pharynx. So the exposure to the stomach acid can irritate and damage the pharyngeal tissues, which result into throat irritation as a result of exposure of the stomach acid to the pharynx, hoarseness as a result of the irritation of the vocal cords, leading to hoarseness and voice changes, and chronic cough as a result of acid reflux induced irritation, which leads to persistent cough. We have several nursing diagnoses that can occur. Um, we have infective airway clearance related to increased mucus production and throat inflammation, as evidenced by patient complaints of difficulty in breathing, hoarseness, and the presence of thick tenacious secretions in the throat. We also have the acute pain related to inflamed pharyngeal tissues, as evidenced by patient verbalization of a sore, scratchy throat. We can also have a patient complaining that my throat really hurts as they grimace when swallowing. We also have impaired swallowing related to the throat inflammation and pain, as evidenced by patients' difficulty in swallowing, drooling, or taking small sips of liquids. We also have risk of infection related to compromised mucosal barriers and exposure to pathogens, as evidenced by the patient's current diagnosis of pharyngitis, elevated white blood cell count, indicating an inflammatory response, and history of recent exposure to individuals with respiratory conditions. Lastly, we could have deficient knowledge related to pharyngitis management, as evidenced by patients' lack of awareness regarding appropriate self-care measures, such as when they seek medical attention or the importance of completing a prescribed course of antibiotics. From here, we can look at diagnostic tests, and we include laboratory and imaging. So the first one, we can start with the throat examination, whose aim is for us to have a clinical assessment of the throat. And possible findings normally include inflammation that is characterized by redness, swelling. We could also have presence of white or yellow patches, especially for the bacterial pharyngitis. We could also do a strep test. This is the rapid antigen test or throat culture. In this case, we want to detect Group A Streptococcus. So positive results suggest Streptococcus infections. Negative result may require throat culture. CBC, complete blood count. This one is used to assess inflammatory response. So we check for elevated white blood cell count, leukocytosis. We also have the monospot test for the infectious monoclonosis. This one identifies antibodies against EBV, Epstein-Barr viruses. So positive result indicates EBV infections. Imaging studies could include throat x-rays or CT scan, And here we want to investigate the complications or severe symptoms. So, fluid collection or abscess formation is normally detected. Allergy testing is used to identify allergens triggering allergic pharyngitis. So here we want to get the specific allergens causing the symptoms. We could also have another imaging test where we carry out laryngoscopy or endoscopy, and we want to evaluate the larynx and the pharynx, especially if in the gastroesophageal reflux disease, where we have laryngopharyngeal reflux suspected. We could possible findings will include signs of irritation, inflammation, or acid reflux disease. We also have testing for other viruses, for example, the influenza virus or COVID-19. So we want to detect the specific viral infection, and this test normally helps identify the responsible virus. So what are some of the types of the range of motion exercises for a patient with pharyngitis? Well, the goal of this exercise is to maintain flexibility in the neck and throat muscles while minimizing discomfort. We could do neck tilts where you sit or stand comfortably with your back straight. Then you tilt your head to the right, bringing the right ear to the right shoulder. Hold there for a few seconds. Return your head to the neutral position. Repeat the tilt to the left side so that you bring your left ear towards your left shoulder. And also hold there for a few seconds. So you need to repeat this gentle tilting motion several times on each side. You could do neck rotation, whereby in a seated or a standing position with your back straight, you slowly turn your head to the right, looking over your right shoulder. Hold there for a few seconds, then return your head into the neutral position. Slowly turn your head to the left, looking over your left shoulder. Hold for a few seconds. Repeat this gentle rotation several times on each side. Next, we could have the chin to chest. Okay, so the chin, okay, to the chest. So you sit or stand comfortably with your back straight. You slowly you lower your chest towards your chin towards your chest, keeping your shoulders relaxed. Hold it there for a few seconds. Gently return your head back to the neutral position and repeat this motion several times. We could also do the head tilt back, forward and backward. So in a standing or a sitting position, with your back straight, you slowly tilt your head forward, bringing your chin towards the chest. Hold there for a few seconds. Gently lift your head back to the neutral position. Slowly tilt your head backward. Look up towards the ceiling. Okay. Hold there for a few seconds and repeat this gentle forward and backward tilting motion several times. We could also have yawning, where you're supposed to sit or stand comfortably with your back straight so that you open your mouth as wide as comfortably you can, as if you are yawning. Then you hold it for a few seconds, close your mouth slowly, and return to a relaxed position. You need to repeat this motion several times. So, what are the types of diet for this particular patient? So, these patients with pharyngitis, they need clear liquid diet, they need soft diet, they need cold and soothing foods, you need to avoid irritants, and you need to maintain hydration. So, in clear diet, you give broth-based soups, clear vegetable or chicken broths, herbal teas like the chamomile or the ginger tea. You give clear fruit juices, could be apple or white grape juice. You also give the gelatin desserts and water. 2 to 3 liters per day, guys. You want to just maintain maintain hydration. You want to soothe the irritation. You want to prevent any dehydration. On soft food, you can give mashed potatoes, oatmeal, cream of white, well cooked rice. Okay, we also have cooked and smashed vegetables, e.g., the carrots or the peas, yogurt, cottage cheese, or scrambled eggs. This is important for easier to swallow. Also, it causes less throat irritation and provides essential nutrients and calories. We also give the cold and soothing foods, which include the ice cream, the sorbet, the yogurt, cold fruit smoothies without the citrus fruits. This one is just to numb the throat temporarily and provides relief from pain. Also, soothing also is achieved. Avoid irritants, avoid spicy foods, avoid acidic foods, e.g., citrus fruits and tomatoes, avoid rough textured foods, e.g., the chips and the crackers, avoid hot beverages. This one helps to prevent further throat irritation and reduces discomfort. We also ensure hydration where you take adequate water and clear broths and herbal teas. This one prevents dryness in the throat, it thins mucus secretion and supports healing process. You avoid alcohol and caffeine. This helps prevent dehydration and reduces throat irritation. We could also be having supplements which are optional where you give vitamin C and zinc supplements. This one they only support the immune system and they may reduce duration of viral pharyngitis. If a patient is given antibiotics, you need to ensure that they complete the full course as directed by the physician. And this is very important for complete uh, eradication of the bacteria. Also ensure we have rest and adequate nutrition. Okay, so you encourage the patient to consume a balanced diet when symptoms allow. So this one helps support the healing process and maintain overall well-being. So what about the pharmacological treatment? So we start with the viral pharyngitis. For the viral pharyngitis, we treat the symptoms, okay? We treat the symptoms. So we can use over-the-counter pain medications like acetaminophen, ibuprofen. This one just helps us provide relief from pain and fever associated with viral pharyngitis. Remember, this one does not treat the viral infection itself. We only work on the symptoms. For bacterial pharyngitis, especially the strep throat, we normally use antibiotics such as penicillins. Okay, we have penicillins, amoxicillin. This one they target and eliminate the causative Streptococcus bacteria, shortening illness duration and reducing complication. So completing the full course of antibiotic is very crucial. Allergic pharyngitis, we normally use antihistamines such as cetirizine and loratadine. And this one helps block histamine effects, reducing allergy symptoms, including throat irritation and other allergic reaction. Lastly, we have gastroesophageal reflux disease related pharyngitis. In this case, we normally use the PPIs, the proton pump inhibitors, and the H2 blockers. Remember this one, these two drugs, they normally reduce stomach acid production and controlling acid reflux and alleviating throat irritation and inflammation. Remember, ranitidine has been recalled from the market, so we have famotidine and others. For the proton pump inhibitors, we could have omeprazole, esomeprazole, and the rest. Thank you so much. You can access the free quiz in the description section just to test your knowledge and reinforce your understanding.